Let's take a look at this coronavirus self-checker which the CDC has come out with on their website. I'll have the exact web address in the description below this video, but as we get into it, this is a guide that they've come out with that'll ask you a series of questions based on symptoms you may be experiencing, or you may be doing this for a family member, which is why I'm doing it. So I'm going to agree to this disclaimer. And it wants us to know, obviously, call 911 if we're experiencing life-threatening symptoms. And this is not designed to replace the judgment of a healthcare professional. So it's asking, are you ill or caring for someone who is ill? In my case, I'm doing this on behalf of a family member. Wants to know if we're located in the United States, and then where in the United States specifically. And then, are you answering for yourself? In my case, for someone else. Age range of the person. Gender of the person. Okay, let's look at these symptoms. These are life-threatening symptoms that it wants to know. Gasping for air, cannot talk without catching your breath, blue-colored lips or face, severe or constant pain and pressure in the chest, severe and constant dizziness or lightheadedness, acting confused, unconscious, slurred speech, seizures. Not experiencing any of those life-threatening symptoms, thankfully. Do they have any of the following? Moderate to severe difficulty breathing, unable to speak in full sentences, coughing up blood, signs of low blood pressure, like feeling cold, pale, clammy skin, lightheaded, or too weak to stand. Again, in this case, none of the above. In the 2 weeks before they felt sick, did they have contact with someone with COVID-19 or live in or visit a place where it's spreading? In this case, yes. Do they have any of the following? Fever or feeling feverish, like chills or sweating, shortness of breath, as long as it's not severe, cough, or other symptoms, in this case, the chills. They do not live in a long-term care facility or nursing home. In the last 2 weeks, have they worked or volunteered in a hospital, ER, clinic, medical office, long-term care, nursing home, ambulance, first responder, any healthcare setting? No, they have not. Okay, they're going to list a number of conditions that they want to know if the person has: chronic lung disease, moderate to severe asthma, congestive heart failure, diabetes, neurologic conditions that weaken the ability to cough, weakened immune system, dialysis, cirrhosis of the liver, pregnancy, extreme obesity, or none of the above. In this case, unfortunately, weakened immune system. Okay, so we've come to the advice they're giving based on the answers that I selected. Stay home and take care of yourself in home isolation. Call a medical provider within 24 hours. You have one or more symptoms that may be related to COVID-19. Stay home and take care of yourself. Call your healthcare provider within 24 hours and start home isolation immediately. That means stay home except to get medical care, and do not go to work, school, or public areas, or use public transportation. I want to also click on this link, 10 ways to manage your health and take care of yourself at home. So let me share the guidance that they're giving me here in case it applies to you as well. Caring for yourself at home, and it's going to list 10 things to manage your health. This is if you have COVID-19 or have the symptoms of COVID-19. First, you want to stay home from work, school, and away from other public places. You're going to avoid using public transportation or ride sharing, monitoring your symptoms, and calling your healthcare professional if they get worse, getting rest and staying hydrated. If you have a medical appointment, call the healthcare provider ahead of time because they need to know that you have or may have COVID-19. Same thing with calling 911, let them know in advance of your condition. Cover your cough and your sneezes. Wash your hands often with soap and water for at least 20 seconds, or clean them with the alcohol-based hand rub that has 60% alcohol. As much as possible, stay in a specific room away from other people in your home. If you have a separate bathroom to use, that would be the best. And if you need to be around other people, wear a face mask. Avoid sharing personal items, cups, dishes, towels, and then cleaning all surfaces that are touched often: counters, tabletops, doorknobs. When you're using the household cleaners or the wipes, look at the directions. A lot of times they'll tell you that liquid needs to be on there for 4 minutes or something like that before it has the desired effect. I hope this video is helpful, at least to let you know that the CDC has this resource available, the coronavirus self-checker. There's a lot more information on that particular page. Again, I'm going to have it in the description below. I wish you the best as we're navigating this pandemic, and we'll continue to come out with as much information as we can that can be helpful.